you're going to be able to pull out something and then and demonstrate it, right? One of these pages. So it's either going to be head, neck with eyes, ears, nose, mouth, and throat. Okay, that's one. That's one. Other one is either eyes or ears, and then you have heart and lungs. So it's going to be one of those 5. And so the most nervous person goes second, right? And whatever one person pulls out, then the other person will pull out a choice of 4. So you got to be able to demonstrate any one of these, all right? Okay, so I'm going to let you pull. You're going to pull my fate here. First one, okay? And so this is, oh, good. Head and neck and lymph and all of that, all of the above, okay? Okay, great. So the first thing I want to do is I want a 2-wipe clean, which means that I'm going to do 2 patient identifiers. I'm going to wash my hands, introduce myself, provide for privacy, explain what I'm going to do. I'm going to clean my instruments, and you guys will clean your instruments, right? And then I'm going to thank her for letting me do a head and neck assessment. So, hi, my name is Tracy. Tell me your name.
Melissa.
Great. What's your birthday?
2/11/85.
Great. So I've washed my hands, and I'm going to give you some privacy, and I'd like to do a head and neck assessment. Is that okay with you?
Yes.
Is it okay with you if I touch your head?
Yes.
Great. And I just want to thank you for doing that, okay? So the first thing I want to do is I want to inspect. And what I see is that her hair is very shiny. It looks like it has good nutrition. She looks like she has good hygiene because it's very clean. I don't see any critters or bugs kind of thing. And I do have a hand, so now I'm going to palpate her head. I see that it's normal cephalic. Do you have any sore spots or anything that hurts?
No.
She has a nice clean scalp here. Do you have any dandruff problem?
No.
No?
I don't know, you tell me.
Okay. Hey, did you bump your head recently?
No.
You got a little red bump there, I saw. Here, right about here, yeah. Might just be a little injury. Okay, so I'm looking at her scalp. Her scalp looks like it's really clean, and that sort of thing. Looking at her head, I see that her eyes are symmetrical, nose is symmetrical, ears are symmetrical. Her mouth is also symmetrical. I'm not seeing any drainage around the ears or the eyes. Nose is not draining. Don't see any cheilitis or split here on her mouth. I see that her neck is symmetrical. Doesn't look like she has a thyroid enlargement. And when I also inspect, I can inspect the conjunctiva of the eyes. That's why I'm putting on some new. I touched her hair, so I'm putting on new gloves. Whenever I touch people's hair or their feet and those sort of things, I always change my gloves. Okay. So let's see. Can you remove your glasses for just a second? And let me just take a look at the conjunctiva of her eyes. And they look like they're nice and clear. Sclera looks really good. So now what I'm going to do is I'm going to look behind her ears. Do you have any pain here when I palpate your ear?
No.
And looking behind your ear, I don't see any rash or anything like that. And on this side here, it looks nice and clean, no rashes, no skin breakdown from anything. Let's see. Looking at her nose, I'm going to ask to inspect the nose. I'm going to be looking inside here, making sure her nares are patent. And I don't see any redness or any white. Don't see any kind of mucus. Let's take a look inside her mouth, because this is also inspection, right? Okay. So using the tongue blade, can you open your mouth for me? Say ah. Oh, do you have a sore throat? No, okay. And let's see, you're looking at her dental work here, making sure she doesn't have any caries. The buccal mucosa is really nice, nice and pink, so I know she doesn't have any air hunger there. Her gums look like they're nice and healthy. Her palate's intact. I don't see any redness. It looks like, let's see, hold on just a second. Let me look at that, your tonsils again one more time. I didn't get a good look. You have one tonsil on this side here that's just a little bit inflamed. Or do you have a sore throat or anything like that over here? No? Okay. It just looks like it's a little bit larger, like it's a 1.5 and the other one. Did you have this tonsil removed on this side? No? Okay, so this is in a 1, where I can barely see the tonsil on this side, but this one's just a little bit enlarged on that side. Okay. And then looking at the neck here, looks like her trachea is midline. So the next thing I want to do is I want to palpate, right? And the things that I can palpate are definitely the sinuses. Does this hurt when I press here?
No.
And here?
No.
No? And can you open and close your jaw? Great. And can you push your hands against my face? Push your face against my hand. You push your face against my hand. Open and close your jaw against my hand. Okay, so I'm looking for head strength. That's something else I can do with touch. Now I'm going to percuss. And the only things I can percuss really are going to be the sinuses, right? Percuss, percuss, percuss. I'm going to palpate the temporal arteries. Ooh, nice and strong on that one side. That's great. And then I'm also the neck arteries here. I can palpate those as well. Great, nice and strong. And then what can I auscultate? Arteries, right? For Bruys? Okay, so now I can auscultate. Make sure I'm on the right side here, but for Bruys I have to use the bell, right? So Make sure I don't have any, I can hear her pulse, but I don't hear any whooshing sounds. And then I'm gonna do your carotid here. I could also listen for a hum on her thyroid if I wanted. Okay, do you mind sitting up on the side of the bed? I think probably for head and neck it may be easier if you sit on the side of the bed, kind of thing, because now what I wanna do is I wanna palpate her, her lymph nodes. I don't wanna forget those, so I'm gonna go preauricular here. You got a strong pulse. Do you have any problems with hypertension or anything, do you? Is your blood pressure up? You nervous, stressed? No? Okay, so it's preauricular, postauricular here behind the ears, occipital in the back of the head, jugular digastric, and I'm gonna check this side here since I found that her tonsil was a little bit large. No, I'm not feeling jugular digastric. Right here is the superficial cervical, and then right underneath that is the deep cervical chain. In the posterior triangle here, that's gonna be your posterior cervical, and then you have your supraclavicular here right near the sternal notch right there. Now I wanna do range of motion. Can you bend your head down and bend your head all the way back, and side to side? Any pain with that?
No.
How about ear to shoulder? And last but not least, I'm gonna do her thyroid check, okay? So what I want you to do is just relax and let me come behind you here, because we usually do a posterior approach for this. Okay, and so what I want you to do is look down and to the right this way. Great. Okay, and I want you to give me a swallow. Okay, and then look down and to the left this way. Okay, give me a swallow. Great. Okay, so did I miss anything? I added some extra stuff, and you can do that. You know, the thing with head and neck is just let the body do the talking. Everything you see is everything you say. Everything you can palpate, palpate. It's going to be sinuses, jaw, maybe head strength if you wanted to. You can also palpate all the arteries, right? Okay, percuss, it's going to be the sinuses. That's the only thing you really percuss, right? Auscultate is going to be the arteries, right? Auscultate the arteries. But then at the end, I had to remember to do the range of motion and the lymph nodes. Range of motion and lymph nodes, for some reason, I always forget a little bit. So I always have to remember those things. You can do this in any order that you want. But sometimes starting at the very top of the head and working the way down for each thing, the eyes, the ears, the nose, the mouth, then the throat. And then remember, I think the best way is just like the heart and lungs, do it. Inspection, whatever you can palpate, whatever you can percuss, whatever you can auscultate, and a couple things you wouldn't want to forget, like range of motion and lymph nodes. All right, so that's our head and neck. Right. So, and I did add a couple of things that you didn't have to add.